Hello viewers, welcome to this course on e-learning for healthcare professionals. This is an online course. I hope this will be of immense benefit to all the participants. The overall objectives of this course are to understand the scope of e-learning in medical education, to see how you can blend digital learning into regular medical education. Most importantly, to understand how to blend yourself into digital medical education, to have an overview of how to design content for uh, medical education in a digital platform, to implement e-learning in the existing scenario. I'm sure you will agree that learning is an individual achievement accomplished by an individual learner at an individual pace in response to individual motivation and personal rewards. E-learning is anchored on this particular concept. Technology is a means, it's not an end by itself. A quick look at the quality of medical education, in particular the patient requirements for teaching. We have a very contrasting scenario in India. In some institutions, notably the government medical colleges, there is an overwhelming patient load, whereas there are very many other institutions where the patient load is miserably low. By and large, the focus on skill-based learning needs to improve. Probably that's why the MCI wanted a skills lab to be added. Traditional ward-based learning is ad hoc and opportunistic. That means the teachable moments are case-centric. What I mean to say is, if there is a 3-month posting in a particular department, the learning is restricted only to the actual cases that are seen in those 3 months. There is no opportunity to learn cases beyond what is actually being seen. The rest, if anything learned, is entirely theoretical. Can technology help in providing scenarios for the other diseases not seen in a routine day-to-day posting? Let's look at some of the MCA amendment notification related to technology. This document is dated 1st December 2008. Medical colleges must have a skills lab and adopt information technology in medicine. They must have provision for an e-library, AC computer room with Medlar and internet facility, minimum 25 nodes. Lecture theatres must have provision for e-classes and virtual classes. And lastly, existing colleges must introduce these facilities in 1 year's time. In other words, by 2009, these things should have been ready. The point we need to understand here, beyond the directives that the MCA has given, is how much IT is going to help in improving medical education. By and large, research in this field of e-learning suggests information technology is an amplifier for healthcare education, just like a stethoscope is for the cardiologist. There are a number of softwares available from the West, but these are extremely expensive. Purchasing power from India is relatively low, so it's difficult that every medical student may have access to these. The question is there alternate ways of approaching how to introduce e-learning into the system? One of the earliest experiments was from the University of Utah, 1992, where they created an encyclopedia of images for the courses and patient cases that complement the traditional medical curriculum. 34,000 images was created, and these were uh, linked to hypermedia based programs. A database was created and made available. Healthcare e-learning is now in India. We are now proud to call ourselves the knowledge power of the world. Medical software is a well-known name in global markets. The issue is, are we ready to design these packages for not only our country but also across the world? You look at the Indian publishing companies, these are largely textbook based. They are a little hesitant to enter the digital medium because of piracy, and even as today the bandwidth constraints. E-learning, the spectrum where it can be applied is quite huge. There are a number of e-learning companies starting up one by one in India, but they need a long time to settle down. There are a number of legal companies which require help from e-learning. The pharmaceutical company is one of the most well-known users of the e-learning scenario, e-learning platform. They are able to distribute product details on CDs, DVDs, pen drives, tabs, and also through the cloud. Can we develop digital healthcare content in India is the question I need to ask once again. There are consortia like IVMeds where excellent information is shared across various universities in the US. There are digital atlases coming up. We also need to work towards developing teaching databases in medical institutions on a shareable basis. CME programs can be recorded and distributed across institutions. Credit programs can be designed and given for general practitioners. As of today, I understand IMA is heading in this direction. Bridge courses for medical and paramedical students in certain areas like medical ethics, communication skills, scenario-based management, etc. can be considered. Medical sales training force, particularly in the corporate world, the pharma industry, is quite popular. Service and product supports are now available through CDs and other platforms, of course directly from the cloud also. Public health education is another domain where e-learning has tremendous potential. For example, fact sheets, details about diseases, nutrition information, demographic data, etc. There is a huge scope for e-learning in the domain of simulations, medical video games, computer-aided patient counseling. Doctors can create excellent databases and use it to counsel patients in their domains of expertise. There are softwares which can be used for time projections. That means you can create scenarios where you can show the patient today, you can show what happens after the operation 2 months from now, 5 months from now, 1 year, 2 years, 5 years, etc. You can use touchscreen kiosks in OPD where information is made available to patients on various topics. Virtual patient is another interesting domain where the student may be let loose in a virtual environment. He is made to take decisions both in diagnostics and treatment, and making him commit to decision making, you will make him learn. think USMLE is one exam where a milestone has been created using the digital platform. There is a tremendous need, the need of the hour, I would say, for faculty empowerment. We need to have training programs, CME programs to create awareness, training program workshops to make them feel comfortable to use the technology. We need to conduct workshops. We need to, not only that, we need to conduct reorientation program, because many times the galloping technology leaves them behind if they are not given this reorientation in a short period of time. There are a lot of hurdles we need to cross while implementing e-learning. First thing, the teachers must be assured that there is definitely a need for change, a need to incorporate technology in the medical education system. Cost is a very, very important factor that we need to understand. Managements are extremely sensitive when it comes to implementing anything that is not specified in the MCI guidelines. We need to convince them and make them think beyond the MCA. Software packages currently available, many of them are poorly designed, and the good ones that are available from the West are exorbitantly priced. On the whole, medical and healthcare institutions in India, the educational groups, they have not taken in an adequate dose of technology into the system. As a result, awareness itself is very low, both in the faculty level as well as at the management level. Lack of skilled personnel, this is another major issue. There is a need for blending this technology with face-to-face teaching. There is a general perception that e-learning is a threat to traditional teaching systems. Unfortunately, this is a myth. E-learning is an excellent complement. It can be blended into the regular teaching system. In the next 3 months, we will give you examples of how we have implemented it in our institution. Time-intensive nature of preparing e-learning resource material, this is a major issue. We need to understand how much time it takes to prepare a good e-learning content. Computer anxiety is something that we also need to look into seriously. Bring the staff out of this technophobia, give them sufficient training so that they pick up confidence in using this technology. Most important, lack of incentives is one of the major issues. There was a major problem in Malaysia on one of the institutions there. The program on e-learning failed to take off because there was lack of incentives to the faculty. Poor standardization of the content in terms of quality across the institutions. We need, most importantly, dedication and commitment at all levels to take this forwards. The involvement of the library department is extremely important, and in the present context is grossly inadequate. Most importantly, there is nobody to champion the cause of IT-based medical education in India. We need to look at this. We have to find out what stakeholders can say, either singly or in a joint approach, take up this issue forwards in a collaborative note. Thank you.